Just pause and look at those images again. This is in a government medical college in Gonda, in Uttar Pradesh. Poonam Muttreja, Executive Director at the Population Council of India, joins us. She looks closely at public health issues. When you see those images, Poonam, playing on a screen of rats moving around in a hospital in an orthopedic ward, what's the first reaction? Is this an isolated case, or does it, in your view, represent what is unfortunately wrong and rotten or rattan in some parts of the country?
This is no surprise, Rajdeep. I have seen dogs in district hospitals and primary healthcare centers. I have seen cobwebs that reach the hospital bed or women lying on the floor. What we're seeing is not just a hygiene failure. What we're seeing is a public health failure. A hospital should be the safest place for patients. When rats roam wards, it signals a breakdown of a system, not just a sanitation situation, but in governance, in funding, in accountability. India spends 1.6% of its GDP compared to the global average of 6%. And this is clearly not an isolated incident. It reflects a systematic failure. And I want to say here that our health minister, Mr. Nadda, is very well aware of this. The first thing when he became health minister, he rolled out a scheme called Kaya Kalp to clean up the hospital facilities in public health. But so they're well aware. I don't know what happened.
No, but is it therefore a problem of funding? Is it a problem of accountability? Is it a problem at the state government level? This is in Gonda district. I mean, what would it take? Let's say, what would it take to ensure that we don't see such images in your view?
Okay, so it's a failure of all. It's a failure of funding. It's a failure of human resources. 40% of government facilities 40% of the staff, not only doctors are missing, but the cleaning staff is missing. We don't employ the right numbers of people. To blame the citizens or patients who brought food, I think is very unfair. So many districts, as I said, the vacancies in housekeeping are 40%. Poor infrastructure directly increases health risks, and hospital-acquired infections, we all know, are 10 to 15% of the mortality. And rodent vectors for disease, they lead to all kinds of very serious illnesses. And I also want to say that the cleanliness is not just about patient safety. It's about their survival. And one-time pest control is not a solution. Spraying after a video goes viral we are missing the actual situation. Dedicated facility management budgets are needed. So I will keep pointing out at the financial, but I will also point out that routine third-party audits of hospital conditions are not done. Real-time grievance redressals don't take place. And here I also want to talk about citizens' engagement. We have Rogi Kalyan Samitis, which are supposed to participate, but they are scared to tell a doctor, to tell a nurse, to point out. They get reprimanded if they talk about cleanliness. So don't just blame the people, though I do want citizens to be not just as silent observers. We have to be participants that raise these issues, and citizens cannot be silent. India has a platform under the National Health Mission, as I said, not only Rogi Kalyan Samitis, but we also have portals for grievance redressal, but none of them work. Like the Kaya Kalp scheme that the health minister rolled out, we roll out schemes, but we are a scheming society that rolls out schemes, and we know what is wrong with our public health system. We know the cleanliness standards are the worst in Indian hospitals. When I go there, I wonder how. I asked a doctor once, I said, what do you do with in the maternity ward with this situation? He said, from my pocket, I give every woman, I spend the money to give her an antibiotic before she delivers in a hospital. That is the
Right.
situation. And we clearly need to not only increase budgets, but we need to we need visible patient rights charters which are adhered to, and time bound public action has to be taken on these reports. But report for this hospital will be the same for reports in other hospitals, Rajdeep.
Okay, I'm going to leave it. Those are very strong words from you, Poonam Muttreja. I hope someone is listening. These are the real issues that really need our top focus. Maybe we got this one wrong. Rather than lead with the poll of polls on exit polls, this is the story that we should have led our 9 p.m. bulletin with. Thanks very much, Poonam Muttreja, for joining me.